Depression. It's a word we hear often, but what does it really mean? Depression is a serious mental illness. It affects millions of people around the world. It's not just feeling sad or down, it's a darkness that can engulf every aspect of a person's life. Imagine waking up every day feeling hopeless. You have no energy, no motivation. Simple tasks feel impossible. This is the reality for many people struggling with depression. It's not a weakness or a choice. It's a medical condition that requires understanding and treatment. It's important to remember that sadness is a normal human emotion. We all experience it from time to time, but when sadness lingers for weeks or months and begins to interfere with daily life, it may be depression. This distinction is crucial for seeking appropriate help. Depression manifests in many ways. It can look different from person to person, but there are some common symptoms that can help us recognize its presence. These include persistent sadness, loss of interest in activities once enjoyed, changes in appetite or sleep patterns, fatigue, difficulty concentrating, and feelings of worthlessness or guilt. The effects of depression extend beyond emotions. It can manifest physically as well. Some people experience headaches, stomach aches, or muscle tension. Others may withdraw from social interactions or neglect their personal care. The impact of depression on the brain is profound. Studies have shown that chronic depression can actually shrink certain areas of the brain, like the hippocampus, which is involved in memory and learning. Neurotransmitters, the chemical messengers in our brains, also play a role. The causes of depression are complex and multifaceted. It's not simply a matter of one thing going wrong. Research suggests that both genetics and environment contribute to its development. Family history of depression can increase a person's risk. This suggests that genes may play a role in predisposing individuals to the illness. However, having a genetic predisposition doesn't guarantee that someone will develop depression. Environmental factors such as childhood trauma, stressful life events, or chronic illness can also trigger depression. These experiences can alter brain chemistry and make individuals more susceptible. It's important to note that depression is often the result of a combination of factors. Understanding the interplay between genetics and environment is crucial for developing effective treatment strategies. The good news is that depression is treatable. With the right support, individuals can recover and live full and meaningful lives. The first step is often the hardest: seeking help. Therapy, particularly cognitive behavioral therapy or CBT, has proven effective in treating depression. CBT helps individuals identify and change negative thought patterns that contribute to their depression. Medications such as antidepressants can also be helpful in managing symptoms. In some cases, a combination of therapy and medication may be the most effective approach. For severe cases of depression that don't respond to traditional treatments, electroconvulsive therapy or ECT, or transcranial magnetic stimulation or TMS may be considered. Supporting a loved one with depression requires empathy, patience, and understanding. Encourage them to seek professional help and offer practical support, such as accompanying them to appointments or helping them research treatment options. Remember, recovery is possible. If you or someone you know is struggling with depression, please reach out for help. The National Suicide Prevention Lifeline is available 24/7 at 988. You are not alone.